conditions that people need to be advised, receive some care, some treatments. بفرمایید بشین خواهش میکنم. Some treatments and sometimes receive some therapies and cares after the treatments. These are all those services provided by health system, and the duty and the task of health system is to deliver these services. But oral health, public health and oral health. Okay, everybody. Public health and oral health. And these services are usually provided by the system. But the point is that sometimes I need a service, I need a care by the system, but I cannot receive it. I go to the center, health center. I wait, but I can't go into to receive the service to the room of the physician, to the therapist, to the laboratory. Sometimes I have not enough money. Sometimes I have not enough time. Sometimes I have not enough knowledge to receive the treatment, to receive the care. So I have not still access to the care. When I receive the care, then I have access to the care. So the ability of an individual or a defined population to obtain or receive for appropriate health care is access. And it involves the availability first of the service, facilities or treatment, and all the services. And that also can be influenced by such factors such as finances, such as geography. Sometimes the center is so far that I cannot have access to the center, and other sociological factors. Sometimes language is a barrier to have access to the care because of culture. Sometimes gender is the barrier to the access. For example, if the patient is a girl and the provider is a male provider. So this difference makes a barrier for access to the care. One is advocacy. What advocacy means? For example, you like to make the exams more easier for you. So you make a group in WhatsApp and discuss it, and sometimes you come and ask the teacher, what are the questions? It's ask several questions from the teacher. So the teacher is obliged to make an easier exam. So you do advocacy for. Sometimes the Parliament passes an act to provide services for a special group of the population. Sometimes, for example, people demonstrate against a law to protest against that. So these are kinds of advocacy. Or in the TV you see an interview about a subject regarding, for example, services for a special group of the people that is in this place in this city, there are not enough health centers, and government should establish more health centers. That is a kind of advocacy. And a combination of individual and social actions designed to gain political commitment, policy support, social acceptance, and system support for a particular health goal is advocacy. And it creates awareness about the subject and creates an environment, supportive environment for the positive or negative impact of that subject. Ambulatory services. Ambulatory services provided on an outpatient basis, in contrast to services provided in the home or to persons who are inpatients. But while there are many patients may be ambulatory, the term ambulatory care usually applies to patients travel to a location. So when the patient travels to the place to receive service, or stay at hospital for some days or nights, that's ambulatory services. And many surgeries and treatments are now provided on an outpatient basis. So we have sometimes services or cares that are received in the home, and sometimes it is in the hospital. So when it is in the hospital, it is ambulatory service. In health, we have a team of workers. Usually there is somebody that is main worker. We as dentists, we are the main provider of services. But when you're providing the services to the patient, there are other people who helps us. For example, we establish an office, dental office, and put the dental unit, dental chair, and start to work. But we have some assistants. We have some servants in the office. We work with the laboratory. We ask the dental technician. The dental technician means that somebody, or an engineer, that repairs all dental equipment. And we buy some materials, some techniques, participate in some courses, extraordinary courses, to learn some new techniques and materials. We work in a team, or we sometimes refer a patient to a specialist. We all work in group, but one of the members of this group is the persons who work with us and help us. These auxiliary persons are very important to the quality of the care provided to the patient. And it has not, sometimes has no degree, and for example, dental assistant sometimes has no degree, but has some courses to get permission to work as a dental team member with us. So these are auxiliary persons or workers. the services in this provided in this system are sometimes very simple, are sometimes complicated, and sometimes very complicated. Sometimes these services can be applied by the patient individually, but sometimes another person should apply or provide the service. Sometimes a team of providers should deliver the service. So there are different combinations of the level of the complexity of the services provided to the patient. And sometimes we define some services as the basic services, those services that are very easy, very simple. These services are not very expensive and can be delivered by not a professional, but some more health workers, some auxiliary health workers. So these are basic services, and with these services, because they are very simple and they are very essential, should be provided to all the people. That is kind of the right, kind of the human right. For example, vaccination. Vaccination is very easy, and for some vaccines, all the people should get the vaccine. So that's kind of a basic service. For some services are, for example, education, how to wash your hands. That's very easy. But if you don't do that, you get disease. And for example, diarrhea. It is a disease that kills and also kills many newborn babies. And if a mother cannot and do not know how to manage that, might be miss her baby. So that's very easy. But that was the reason, and is the reason of many deaths under 1 year of age for newborn. So these are the basic services, and a network of places and workers and facilities and interaction between these health workers established, and they name it primary health care system. There is a system, there is a network that provides these services. These services usually should be provided to all people easily, and the people should have access, not traveling more than half an hour to get these services. So there is a network of health units, health centers providing essential health care to the population. Basic health services include communicable disease control, environmental sanitation, maintenance of records for statistical purposes, health education to the public health, nursing and medical care. For example, in these services, people catch cold. That's a very simple disease. and they need medication. And in a village that has no access to pharmacy or physicians, and the number of villages in any country is so high, so they need a person who provide these services, and there is no need to a physician in that place. That's an example of basic services. Burden of disease. That is a example of burden of disease. I have a problem in my throat and cannot speak so much, so I should drink water between of my speaking. That's a burden. So that is a burden. You see, it's a burden. Have to wear eyeglass. And you've seen probably old people that cannot chew very well and their lips are collapsed. That's a kind of burden. Or sometimes people miss their teeth here and the lips are on the inside. So that's a burden. And then an anterior teeth is missing. So you've seen probably if somebody has missed his or her anterior teeth, covered muscle, not to be seen by the people. That's a burden. Or we have steps here, come to the first floor. And if somebody has a broken leg, have to use the elevator, and if there is no elevator, cannot participate in the class. That is a burden. And if he wants to walk in these streets, cannot walk easily by his wheelchair. So these are examples of burden. A total significance of disease for society beyond the community. Cost of the treatment is burden. And there are some examples. Which of you like to miss one of your teeth and be extracted for $10,000, $20,000?
No one has
Think, no one,
No one.
no one, $100,000. Think about that. I pay for $100,000 for one tooth. So, if it's $1 million, 1 million, you can think. But people pay for a kidney transplant for some amount of money less than that. So sometimes we can measure, we can count the price or the value of an organ of health of some parts of the body. So, and if compare these two, an individual in age of 55, 60, 70 might get cancer, and he can live for just 2 years with this cancer. But if he treat the cancer and pay $100,000 for treatment, then he can live 3 years. Compare this to, is it good for him?
Yes.
Yes. But if this family has not enough money and can buy a home for the whole family, or a house for the whole family, and these are, for example, a wife, three children, and they can live in a better condition for their whole life with this $100,000. The father, for example, prepared to live 1 year less and have access to this house. That's an example compared. So the life can be measured, can be calculated, can be compared in a numeric matter. And we compare the value of different organs of the body and value different diseases. And that is the burden of a disease. For example, and it is the total life is 1, and total death is 0, and it is from 0 to 1. The index for measurement of the burden. And for example, periodontal diseases have a burden of 0.0, for example, 5. Dental caries have a burden of, for example, 0.09. Oral cancer might have a burden of 0.1. Or diabetes, for example, 0.15. So there are some methods to calculate the burden of disease. And care. Yes. Care means taking care of patients. We take care of patients. Sometimes when it is in a hospital, we take the pills and ask him or her to get the pills. Sometimes we, for example, change the temperature in the room in a comfortable point to take care of the patient after a surgery. Sometimes the patient has wisdom surgery, and after that we ask him to take mouthwash to reduce the number of bacteria and for a better healing of the surgical place. So these are some kinds of care, but there are different types of care. The intermediate care is a short period of intensive rehabilitation and treatment to enable people to return home hospitalization. But basic care, in general care focused on the point at which a patient ideally seeks assistance from the medical care system. And this might be the individual refers personally or seeks personally care, or sometimes has gone to the health center and the auxiliary person refers him to the next level. So if he goes to the more complicated center, in a higher level of providing the services, so this is the secondary care. And a specialist provide the care there, and the patient receives ambulatory or inpatient services. And tertiary care tertiary care is provision of highly specialized services. So this is tertiary care. And caregiver is the person who delivers the care, provides the support and assistance, formal care or informal care. You see, in the recent years, we have telemedicine that provides support and care and services through net, and they provider is somewhere else and provides advices, mental advices or other advices for better health. And sometimes these services are emotional services for some. Sometimes the services are financial support. And there are different types of services. And clinical trial. The other word is clinical trial. Trial means study, means a set of activities to do a study. Clinical trials are important because our knowledge are based on experimental knowledge, and we have to try some process and some tests, for example, some treatments several times to see if the results are similar in different settings or different conditions or not. So the knowledge of the medical knowledge is based on these trials. Trials usually are done in different countries, in different populations, in different age groups, to see, for example, a tablet that is built for a special disease, have a positive effect or have effectiveness on treatment of a disease or not. So a controlled research study of the safety and effectiveness of drugs, devices, or techniques that occurs in 4 phases, starting with the involvement of a small number of people, then the latter stages in which thousands of people are involved prior to the approval of by the assessing authorities. So there are different, you remember Corona, do you remember So you remember that vaccines introduced had to pass different levels to be received by all people. And they would tell that these vaccines are made but have not passed different levels to be applied for all the people. So these four phases are that was we remember for corona. Clinical trial is a controlled research. Okay. Community. The other one is community. We have different names for the groups of people. One of them is population. The other one is community. The other one is society. Or and then we have another word that is association. Community is a group of people often living in a defined geographical area, or people that share a common culture, common value, or common norms. All of them can be named community. So sometimes a geographical borders define the community as, for example, you in this class might have a Iraqi community, or other. You are a community, might be a community. If you gather together and have relationships together. If you don't have any, yes. No. No means when you sit in the class, listen to the teacher. If you don't listen and talk, that is not no. That's an example of no. No means that I talk with a voice that you can hear very well. If I talk, okay, that is not no. And if I talk, hi everybody, that is not no. And in health is that I can wake up, I can come to the class, I can talk, and I talk with you without putting my hand over my mouth, because, for example, I have not that teeth, or I can talk for 1 hour with small amount of water, and, for example, no means that I have no pain here or any disease. That is no, and I can take part in the activities with in society. I can be a positive person with a healthy mental health. That's an example of no. Yes. Good. نور میشه، نور هم میتونیم بگیم نرمال، طبیعی منظور هم طبیعی. Something that is in the middle, not so bad, not so good. That is no. And values and norms. For example, when we are sitting here in the class, the temperature is a bit cold, but near to normal, because we are sitting here and we are talking together. That's the lower margin of north, but it is in the north areas. The temperature is north. For example, north can be defined, the temperature can be defined from 18 to 25, 26. But if it is higher than that, it has members. and these members gain the social identity within the community and are accepted by that community. If 10 or 20 of you have contacts in the class and have relationships or a gathering, you might be a community, and each of you are accepted. The identity of each of you are accepted by that community. Or there are examples. So the other word is disability. Vice versa, ability. When there is any restriction or barrier for an activity, for a condition, for a position in the society, for example, that might be named a disability. So, disability reflects the consequences of impairment in terms of functional performance and activity by the individual. So, any disturbances at the level of health of any people is named disability. And it is very important when this disability happens. Something such as smallpox that happens in early ages, have a disability adjusted life years, a very heavy disability adjusted life years. We name it DALY. We had quality adjusted life years. And there is another word, disability adjusted life years. Imagine that somebody has a life expectancy of 74 years, and if he gets disease in 50, so have to live 24 years with the disease. And if we calculate the prevalence of this disease, 10%. So 10% of people live 24 years with the disease, but 90% of people live to 74 healthy. If all people, all 100 people live 74, multiplication of 100 on 74 is 7,400 years living healthy. But if we decrease that people who are diseased, that 10% who diseased by that disease, and if we measure, for example, a burden of 0.1, so part of people, 10% of people live for 24 years. If we, for example, measure the poor health as one, these people live with 0.9 of poor people. So total health of this community or population will not be 7,400 is less than that. These are different types of calculations. Don't worry about that, just want to make an imagination for you how they calculate. And what is disease? The word disease, any failure of adaptive mechanisms of an organism to contract adequately, normally and or in no condition, as you asked, or appropriately to stimulate and stresses to which organism is subjected, resulting in a disturbance in the function or structure or some part of the organism. So, disease is got from this ease. So, ease means comfortable, and this is uncomfortable. Any exit from the norm or normal condition is named disease for a organ or an process in the body or an activity. For example, the activity of eye is watching, and that is kind of a disease. Disease is a very elusive and difficult concept to define, being largely socially defined. Sometimes somebody have a normal body and is very powerful, has no disease in the organs, but cannot, for example, cannot interact with other people, have no mental problem, but cannot make relation with other people. That might be defined as a disease. There are different kinds of diseases. All measures and activities, procedures, and cares that designed to prevent, to reduce the problems of the health are named as disease control. And in actually all countries, there are some centers for controlling the disease, and these are named Centers for Disease Control, or CDC. And the diseases are divided normally non-communicable diseases or communicable diseases. So, Center for Communicable Diseases, controlling communicable diseases or non-communicable diseases. CDC might be divided to different parts or separate organizations, NCDs or CDCs. Environment. Environment is all the surrounding areas. For example, in this class, now the environment is normal. But sometimes me as a teacher enter the class and all the students talk, and I cannot run the class normally. So the environment is tough for me. or the environment of the class might be pleasant for you, might be cold for all, might be normal as lightning, might be abnormal because of noises from outside. These are named environment. Might be risky because of a step might be over here, and if I walk here, I can might be fall down because of that step. So the environment is risky. So these are different types of examples of environment. Another one is epidemic. Certainly all of you understand, felt very well what is the meaning of epidemic. And when a group of cases or a specific disease or illness clearly in excess of what we normally expect. So, did you see the question he asked was a very important question. What is normal? What is normal? We expect some of us catch cold in this season. But if the number of, for example, children in a class that catch cold are more than, for example, 10% of the class, we might name it abnormal. And epidemic is when many of the people get disease. There is no absolute criterion for using the term epidemic as a standard, and expectations change. So you remember in the corona area, when the number of people disease increased from a specific amount. So then, for example, now we might have pollution, but if the number of days with pollution increased from some days, then the government decided to reopen the jobs. So if it's very difficult to define a specific norm for that. Epidemiology is the study of the different factors that influencing the health, helping the health, and preventing the diseases and controlling the diseases or injuries, or what name health-related events, whatever is related to health. All of them are named. Studying these things are named epidemiology. From the risk factors for the diseases, from the diseases, and also impacts or outcomes of the diseases, and methods of the treatment of the disease. All of them are named epidemiology. Evidence-based care. Evidence means some certificate for being through that we make name statement. They, for example, acetaminophen is useful for pain relief. That's a statement, but should be tried different times in clinical trials to should be an evidence. And explicit and just judicious use of current best evidence in making decisions. And when we might decide about the condition of a patient, for example, our decision should be based on a true evidence, a real evidence. And if we make a mistake, that is the fault there, might be not as according to a true evidence. And all of our cares we provide for the patient should be based on evidence.